Hi, everybody. My name is Dr. Schnorr. For those who I haven't met before, I'm one of the founders of Coastal Fertility, and I'm excited to be here with you today. I have a very special person with us today, probably the most important, most popular person in the entire building.
I don't know about popular.
Well, it depends on the situation, right? Shannon Rowland is one of our financial coordinators. Shannon is really one of the founding members of Coastal Fertility. We were just talking about the fact she started about 3 months after we started Coastal Fertility, and we were talking about all those kind of challenging things that we went through at that time, which we won't have to talk any much about today. But we're here to talk about what is generally the most important thing, I think, for patients to talk about, which is the financial aspect of fertility treatment. Unfortunately, those are things we need to talk about. I remember when we had younger kids and we went to see the orthodontist. We were meeting with the orthodontist, and the orthodontist told us they were going to do this and fix the teeth and do this and do that. And I said, that sounds just great. How much is that going to cost? And she said, well, I don't talk about cost. You have to go meet with the financial person. And I thought that actually wasn't great, right? I mean, I really feel that the cost is a very important part of it. And, you know, what we want you to know is that cost matters. We know cost matters to you, and we want to make it right for you, which is the reason why we're doing Facebook Live with you right this second, is because we think it matters. And the way we work things out regarding costs is that we actually meet with you during your new patient visit. With that, we understand your history, what you've been going through, maybe what the causes of infertility might be, and then we start to understand what some of the different treatment options would be. And then we put together a plan, our recommendation for you. Here's the tests that we recommend. Here's the treatments we recommend. We even, in that plan, have the dosing in so that as soon as you're done, you'll meet with your nurse. And then the most important meeting, of course, is with Shannon and her partners, who will go over with you, A, what your insurance covers and what it doesn't cover, B, what your doctors have recommended for your testing and treatment, and then C, what we estimate your costs to be. And that's an important part of it. It's just an estimate. Some feel that's not fair, that it should be a locked price. The price that we quote you will be the guaranteed price for 3 months. Is that right?
Yes.
3 months, so we don't change the price. But if you need additional services, like we find an ovarian cyst or an endometrial polyp, or there's new findings during your testing, we're generally going to recommend a way to fix that problem, and that may have costs associated with it. And of course, if that were to come up, you would then re-meet with Shannon, and she'd say, well, they found a polyp, your insurance covers this, it doesn't cover this, here's the cost to, for example, remove a polyp. And so that's the process that we go through to understand things. Shannon is here. She's not particularly excited to be here today. I'll be honest with you about it. She's not excited to be here, so I'm going to kind of guide her through this a little bit. So the first thing I wanted to do is kind of go over that process. Now, I do get I had to have patients say they'd rather meet with the financial coordinator before they meet with the doctor, right? I understand that. But the problem is the financial coordinator then doesn't know the plan, so therefore they have nothing that they can quote. So we got to do it at the end of the visit. You will get a written quote that breaks down the cost of everything, our best understanding of what your insurance coverage is, and then with that, you'll be able to leave with a written estimate as to what we think things are going to cost. So I want to kind of ask Shannon some questions along the way. First and foremost, we do accept insurance. Yes. What insurance carriers do we work with, Shannon?
So we are contracted with Blue Cross Blue Shield, United Healthcare, Aetna, Blue Cross Blue Shield PPO, Blue Cross Blue Shield State, TRICARE. Some of the other companies that are like smaller companies that are part of United Healthcare all kind of work under the same umbrella. One that we are not contracted with is the Blue Cross Blue Shield Marketplace plan that came out a couple years ago for individuals. I feel it's important to know that because they'll call us and say, do you take Blue Cross Blue Shield? And we say yes, but it happens to be part of the Marketplace plan, and unfortunately we don't take it.
Is that kind of what's otherwise known as Obamacare?
Yes.
Yeah,
yeah, exactly. And we decided not to because they did not offer any fertility coverage whatsoever when that came out.
Yeah, so they don't provide fertility coverage. There's no reason for us to accept that. So we do accept every insurance carrier that pretty much most insurance carriers. Mm-hmm. Yeah. And so the first question is, let's say you come in with insurance, Shannon, and you have infertility and we're seeing you. but they don't have infertility coverage. Will they still get some benefit by having insurance seeing us?
In general, most of the insurance companies now will cover the testing, pre-testing, if they don't cover the actual treatment itself. So it does give them some benefit there. There are far more companies that are and it's not the insurance company itself that offers the fertility coverage, it's the employer that chooses the fertility coverage for you. What we've been seeing since I've been here in 10 years, that when I got here, there was very few companies that offered coverage, and it has definitely significantly increased since then. I'd say when I started here, it was like 30% of the patients that came in. It's probably more like 60 to 70 patients now. There are 3, or probably more than 3, of these what we call third-party companies that employers are bringing in that offer fertility coverage as a separate entity from your medical. So such as like Progeny, Kind Body, there's another one called Carrot, and a new one that I've recently found out about called Maven. So there's a lot of better options now, I think.
Can you explain to them a little bit about who those companies are?
Sure. So Progeny, essentially Progeny and Kind Body work the same way. They set up a sort of a fee schedule with us. They say, this is what we're going to pay you. The patient actually pays the company itself for any of the out-of-pocket costs. They actually won't pay Coastal itself. Maven and Carrot work a little differently. You're actually like a self-pay patient, and then they reimburse you.
Yeah. Now the employer has the agreement with Progeny, right? So you have to work for an employer who then has benefits through Progeny, Carrot being the same. And so can you tell people what some common employers are in the area that currently have fertility coverage?
So Target, Starbucks, Tractor Supply.
That's my favorite, Tractor Supply.
But you only have to work
I
10
love
hours.
their products, but I like the fact that you can actually literally, I think, just
10 hours.
10 hours a week for 1 month. And you get full fertility benefits that I think even includes egg donation.
Yeah, they've done a great job with that.
Yeah.
But there's a lot of them around here. I mean, there's medical.
You might get discounts on tractors.
Yeah, exactly.
I mean, there could be real benefits to this all the way around.
There are, so like HCA now offers Progeny, but like even retailers like DSW Shoes, Kohl's, they all offer benefits. So what I found in some of this, because I get this question very much from patients who don't have coverage, or very often, there is actually a group on Facebook called Progeny IVF Jobs that you can join, and there's probably like over 2,000 people on the group as of right now, and it'll actually tell you like all the different companies that offer Progeny as a benefit, which is probably the biggest one we work with at this time. Kind Body's getting there, but they have the most opportunities.
Yeah, so that's great. So if you're then coming through, and for example, they're going to do IVF, and they have State Blue Cross Blue Shield, typically we would expect that the State Blue Cross Blue Shield, which is, if you're a state employee, would cover a significant portion, about 70% of care. Is that right?
Yes, 70% of what we can bill to insurance. There's still some out-of-pocket costs for patients. Even with any insurance company that has coverage, there's always going to be some out-of-pocket for them. But Boeing is another one added benefits this year, as well as Blackbaud added benefits back in. So there's a lot of really good opportunities to use that. I haven't had one that's 100% coverage at this point, but some of them are really great.
And so that was my next question: is do any provide 100% coverage?
No.
Sounds like the answer is no.
No.
But some provide the lion's share coverage. How about for patients who want to freeze eggs? Do we know many that will pay for egg freezing?
Progeny will offer egg freezing. The state, unfortunately, that doesn't meet their criteria, as well as most of the commercial insurances. So like United Healthcare, Aetna, they don't consider that to fall under the realm of infertility. So there are a lot that do not cover egg freezing.
And so that's important. When you come into the doctor, it's good for you to know what your benefits are. And if you have an insurance plan that requires infertility as a diagnosis, it's important that you express that you have infertility to your doctor if you do have infertility, so that we can make sure you get good benefits along the way. We need to document that for you. So that's important. How about for same-sex couples? That's a common one for us. Do we have coverage for same-sex couples?
Same thing with the state plan, but the other insurance companies, I haven't found much issue with those. So any company that's offering fertility coverage, aside from that one, I haven't had an issue getting coverage for them.
Right. Okay. And then can you explain to us a little bit about we make an estimate, we say we think you're going to get this coverage, but then their coverage is different, that the insurer makes the decision.
Right, so at the end of the day, and this goes for testing as well, this is all diagnostic driven. So what the physician provides as the diagnosis, especially for testing, when the claims are paid, that's what's determined what will be covered. So if you are a person who does not have fertility coverage, then using a medical diagnosis for testing would allow that testing to go through. So that is very driven on that part of it. As far as fertility wise, any treatment that we do, you would need an infertility diagnosis for that to be covered, for that to meet the insurance company's criteria.
And at Costa Fertility, we're always going to try to help you out and find a true, legitimate medical diagnosis for doing the testing along the way. If it's infertility, it's got to be infertility, but sometimes there's things like polyps and fibroids and decreased egg count and irregular menstrual cycles and things where we can help get you a medical diagnosis that hopefully gets you a little bit better coverage along the way. So we're always going to do it the right way and legally, but we can hopefully find it in a direction that benefits you along the way. And so, Shannon, we get a lot of people who are going to be cash pay. I think we said that's 30-40% of what we have. How do we handle in medications? How do we help them get the best price on medications, those types of things?
So on our website, along with the forms that I give out or all of our financial counselors give out for their consult, is 2 medication discount programs. One is called Fertility Savings, which if you apply, you can get a discount for the Gonalef medication that you use through the pharmacy. The other is Reunite, and they are a follistim company, so we work with many pharmacies that use both. So I encourage everyone to apply for both, whether you're going to do IUI, IVF, because it is good for 1 year and you can use it multiple times. The other option that we give to patients that's on our website too are companies that offer financing. So we actually work with 4 companies now, Lending Club, Ally Loans, Future Families, and now a new one called Hera, that offer a way to finance anything that comes to Coastal, as well as the pharmacy, and also to the genetic company that we use as well.
I put a link in the comments.
And we're going to put a link in the comments for you so that you have that. So what about patients who come in and say, God, this is hard, I have to pay cash for this, there are no guarantees on this. Do you have any guarantee plans, guarantee that we're going to get pregnant?
So we do offer a multi-cycle program for cash pay patients or self-pay patients. One is called shared risk. So there are some qualifying factors that are involved with shared risk to qualify for that. So the physicians will look at your BMIs and your age, your day 3 labs, and you all kind of have semen analysis, have to qualify for all of that. But what it offers is a chance to do 2 or 3 retrievals and unlimited transfers. The 2 retrieval program offers a 50% refund if you are not successful. Success means live birth. So if you bring a baby home at any point during that program, it's good for 1 child, then the program does end. But if you went through the entire program, the 2-cycle program offers a 50% refund. The 3-cycle offers a 100% refund.
Right. So I think obviously from the medical standpoint, we can't guarantee to anybody that they're going to get pregnant. But we can guarantee you that if you don't give birth to a baby, you can get your money back. And so there are guarantee plans for that. They work really only in the IVF and egg donation side of the world. They're not available for IUI.
No,
there are some exclusions based upon age if you're using your own eggs. There are some exclusion in egg donation with weight and other things. But for the most part, people with egg donation, I think, would qualify for the most part and be able to get into that. And so, so you pay a little bit more up front, but you get a 100% money back guarantee that if you don't give birth to a baby, you get back all of your money along the way.
The nice thing too is that for patients who may not qualify for shared risk, we also offer what we call a multi-cycle package where you still get the 2 retrieval unlimited transfers. So this is sometimes presented to patients who think we may need more than 1 retrieval to get the embryos we need to work with to do this. And so that's a great program where you can batch your cycles and use that to kind of create more embryos for future use as well.
Yeah, a great option. Well, it looks like we got some questions along the way. Before we go to questions, Shannon, is there anything else that you commonly get as questions that you want to review today?
Honestly, the biggest one is insurance and is there coverage? How can I find coverage for fertility treatment? And that's when I talk a lot about the companies we talked about that offer benefits. I think the group on Facebook that talks about the IVF jobs or employers that have it would offer a really great source
Yeah.
for patients to look into. So I would definitely look into that. And basically the financing options and discounts and what can we do to help finance this?
Yeah, and we do, require payment up front, and that's an estimate on what things are costing. And often patients, maybe don't need as many transfers, other things, and they ask, do they get their money back? And we are just like any other physician's office. We only charge for services rendered. So if you pay us a deposit of X amount and you only use a percent of it, and that money is still yours, you can have it back at any time. Just call us. We'll send the money back to you. We do embryo storage here on site also, and so that money can be applied to embryo storage. Let's ask Holly, we have any questions?
We do have one, and this is from a new patient, Caitlin, and she said she's planning to start IVF in April. She had her first appointment in March, and she was wondering when she would hear from financing on what the costs would be during the process. And I guess that's a bigger question, is how long does it usually take
So
for insurance to respond?
So basically, what I tell patients when I do a consult, when I'm doing the financial estimate, I say when you get your day one period and you are ready to start this IVF process, reach out to your nurse. She will create your IVF protocol letter with all your dates and how this works. And I tell them to reach out to your financial person as well, because then we will go back and say, hey, this is what we talked about cost-wise. This is when it'll be due. We can take payment over the phone. You can do that online. And we just basically review that with the patient to make sure they're clear about how that works. But if you call on day one, we tell patients that payment is actually due 1 week before you start your injectable fertility medication. So that Gonalef or Folliston medication that you're taking, we should be reaching out to the patients as well. So we try and reach out, send an email as a reminder, just to kind of say, hey, you're getting ready to start. This is the process.
Yeah. And a lot of people wonder if we do financing ourselves. We don't. Frankly, we're a little bit too compassionate for that. I don't think we would collect as well as we should.
I would have a
So we do not do the financing ourselves. We do let bankers do the financing. A lot of patients are upset, that we collect a deposit up front and don't charge them at the end. And my answer is a frank one, that you can repossess a car if you don't pay for your car, but you're not allowed to repossess the baby. And we have had many patients who give birth to a baby and decide they don't want to pay us, and we honestly don't have a recourse. And we have very hardworking staff who deserve to be paid, and that's honestly what that's about, is making sure that they get reimbursed for their time and effort to be here. So we love what we do. We're sorry that finances are part of it. In some ways, it would be nice if the government just paid for everything, but I think we can imagine how that would end up too. So pass on that idea, and we'll just continue to do everything we can to be transparent about the costs and help you through it with your insurance carrier. That's why we accept insurance from all the carriers. Honestly, we don't get paid well from the insurance companies, but it's a benefit to you, and that's something that we're committed to doing. Not all fertility centers are, but we feel that you will get benefit by having insurance coverage. So.
Can you please review again how we are able to pay for our IVF cycle? The different ways: pay online, call the office.
Sure. I did that a little fast.
Okay.
Sure. So we can do payment over the phone. Like, you can just call into the front desk or any of us, the financial counselors, and we can run your payment over the phone. There is a tab under the resources tab that says pay bill online on our website. So that's an easy way to do it. You just need to know what the amount is you're putting in. You can do a certified check. You can mail that in as well. You can stop by the office and do it in person, or any of our offices. Well, I shouldn't say any of our offices. Mount Pleasant, Lexington, Nexton, or Savannah now can take payment. Unfortunately, Myrtle Beach is our only one that doesn't have that opportunity.
Okay, and then I got a text. Can you talk about the new patient appointment, the very first patient? How much does that cost?
The new patient appointment is $255, and that is just the self-pay cost. So if you have coverage, then that will go towards insurance as well. And if they do semen analysis along with it, it's $140.
Right, so $140 for the semen analysis, $250 to see the physician. It's a 1-hour visit with the physician, where you'll get a review of your history, you'll get a physical exam. It includes an ultrasound, which actually is an important component to make sure that the uterus is normal and make sure that the ovaries are healthy, and you'll get immediate feedback on that. We use that information to make your plan during that second part of the half hour, so that you get a full hour with us with initial history, ultrasound. We put the plan together. You then meet with a nurse, and then afterwards with a financial coordinator who's going to kind of go over all that. No rush to make decisions. This is just an education day. Once you leave with your packet of information, your idea of what you're up against, what's covered, you can just take some time and talk to your partner about it and figure out, if something works, and then we can help you move forward if you choose to do that.
Those are the main
Okay.
questions that we got.
I always tell patients too that after that first visit, get that pre-testing done, which is like the three major things: day 3 labs, semen analysis, and HSG. Don't worry about the rest of it at the moment, because once you get that back, you have a better idea of where you're going to go from there. Because that's always kind of a big. By the time they see me, they're like deer in the headlights, and it's a lot of information.
Yeah. Okay. Well, I owe Shannon a shot of vodka, so I'm going to go get that for her now. And I appreciate you guys all being here with us today. See you later.
Thank you.
All right. Bye bye.